Assalamu alaikum everyone. I am Dr. Moaviz Aslam. I am resident in ENT at Benazir Bhutto Hospital and I am the mentor for ENT for FCPS 1 online course. I welcome you all to this webinar on paranasal sinuses. Paranasal sinuses is a very important topic for ENT Part 1 exam. So first of all, we will be testing your knowledge with some past CPSP MCQs. So those who are joining us on Zoom can write in the chat box, and those who have joined us on Facebook Live, they can comment and we can see their answers. The first CPSP MCQ is, which of the following sinuses are usually present at birth? Option A is sphenoid and frontal, B is maxillary and ethmoid, C is maxillary and sphenoid, and D is sphenoid and ethmoid. जो भी आंसर आप समझते हैं ठीक है, वो आप कमेंट कर दें या चैट बॉक्स में टाइप कर दें. Okay, so next MCQ is maxillary sinus opens into A is superior meatus, B is middle meatus, C is inferior meatus, and D is nasal septum. Whatever answer you think is correct, please type it, and we will revisit these MCQs in the end. So third MCQ is, which paranasal sinus is the first to develop in the intrauterine life? Maxillary sinus, frontal sinus, sphenoid sinus, or D is ethmoid sinus. So the fourth CPSP MCQ is posterior ethmoid sinus drains into A is superior meatus, B is middle meatus, C is inferior meatus, and D is sphenoethmoidal recess. So whatever answer you think is correct, please comment or type in the chat box. Okay, so starting with the webinar, what do you understand by paranasal sinuses? Sinuses are basically air containing cavity, and paranasal means around the nose. So paranasal sinus means air containing cavity around the nose. We basically have four pairs of paranasal sinuses. They are further divided into anterior group and the posterior group. Anterior group में जो एक common बात होती है, they all open into the middle meatus. Anterior group of paranasal sinuses include maxillary, frontal, and the anterior ethmoidal sinus. Whereas the posterior group contains the posterior ethmoidal and the sphenoid sinus. तो अब हम अगर इसके इधर से एक लाइन ड्रॉ करें, ये जो इस लाइन के इंटीरियर लिए, they form the anterior group, which include the maxillary sinus, the frontal sinus, and the anterior ethmoidal air cells. इन सब की जो कॉमन बात होती है, they all open into the middle meatus. Whereas इस लाइन के जो पीछे वाले साइनसेस होंगे, they include the posterior ethmoidal air cells and the sphenoid sinus. This is the sphenoid sinus, and here you can see the posterior ethmoidal air cell. Posterior ethmoidal air cell drain into the superior meatus, and the sphenoid sinus drain into the sphenoethmoidal recess. So quickly revising this slide, we have four pairs of air-containing cavities in the skull, which are divided into anterior group and the posterior group. The anterior group of the sinuses, they all drain into the middle meatus, which include the maxillary sinus, the frontal sinus, and the anterior ethmoidal sinus, whereas the posterior group of the sinuses, they all drain into the superior meatus and the sphenoethmoidal recess. Posterior ethmoidal air cells open into the superior meatus, whereas the sphenoid sinus open into the sphenoethmoidal recess. So this is a very important slide. This is showing the lateral wall of the nasal cavity. इसमें से septum को यहाँ से remove कर दिया, तो आपको lateral wall of the nasal cavity नजर आ रही है। इसमें से हमेशा ENT के पार्ट 1 एग्जाम में 2 से 3 MCQs आते हैं। तो इसमें अगर आप देखें, you can see 3 turbinates, the inferior turbinate, middle turbinate and the superior turbinate. हर टर्बिनेट के जो नीचे वाला एरिया होता है, जो टर्बिनेट कवर कर रहा होता है, उसको हम मिएटस कहते हैं। इंफीरियर टर्बिनेट के नीचे होगा इंफीरियर मिएटस, मिडिल टर्बिनेट के नीचे होगा मिडिल मिएटस, और सुपीरियर टर्बिनेट के नीचे होगा सुपीरियर मिएटस। और जो सुपीरियर टर्बिनेट के ऊपर वाला एरिया जो उससे ऊपर है, उसको हम कहते हैं स्फीनोएथमोइडल रीसेस। तो सबसे पहले मिडिल मिएटस में कौन से साइनसेस ड्रेन करते हैं? यस, मिडिल मिएटस में ड्रेन करेंगे द इंटीरियर ग्रुप ऑफ द पैरानेजल साइनसेस, which include the anterior and the middle ethmoidal air cells, the maxillary sinus and the frontal sinus. Superior meatus में ड्रेन करते हैं posterior ethmoidal air cells, और sphenoid sinus drains into the sphenoethmoidal recess. और inferior meatus में एक duct open हो रही होती है which carries the tears from the eye to the nose. It is called the nasolacrimal duct or the nasolacrimal canal. So quickly revising, this is the lateral wall of the nasal cavity. इसमें we have 3 turbinates, superior, middle and inferior turbinate. Each turbinate is covering the meatus. Below the inferior turbinate, we have the inferior meatus. Below the middle turbinate, we have the middle meatus. And below the superior turbinate, we have the superior meatus. And above the superior turbinate, we have the sphenoethmoidal recess. All the anterior group of the paranasal sinuses, which include anterior and middle ethmoidal air cells, maxillary, and the frontal sinus, open into the middle meatus. Sphenoid sinus opens into the sphenoethmoidal recess. The posterior ethmoidal sinus is open into the superior meatus, whereas the nasolacrimal duct opens into the inferior meatus. Then we will be looking at the maxillary sinus and the important points to remember. So maxillary sinus is the largest paranasal sinus. It is the first to develop in the intrauterine life. It is also called the maxillary antrum or the antrum of Highmore, as it is the largest mean more, and it is also called the antrum of Highmore. And maxillary sinus reaches adult size by the age of 15 years. So there are three F which makes the maxillary sinus easy to remember. First F is the first sinus to develop. It has a volume of 15 milliliter and it reaches the adult size by the age of 15 years. एक जो इम्पोर्टेंट पॉइंट है जो ईएनटी और डेंटिस्ट्री के कैंडिडेट्स के लिए स्पेशली वो ये कि यू कैन सी दैट मैक्सिलरी साइनस is closely related to the molar teeth. So whenever there is an infection of the molar teeth, there is a chance of the spread of infection to the maxillary sinus. Then we have the ethmoid sinus. Ethmoid sinus are divided into two groups and they are second to develop in the intrauterine life. As we have already discussed, the ethmoid sinuses are divided into the anterior and the posterior ethmoidal air cells. This is a very important table which has been taken from Dhingra. इसमें बहुत सारी information बड़े concise form में आपको दी गई है. तो जो लोग फुटबॉल के फैन हैं या फुटबॉल देखते हैं उनको पता होगा कि एक फुटबॉल का प्लेयर है मेसी. तो ये एक निमोनिक है जो काफ़ी इजी कर देता है इसको याद करने में. मेसी के फर्स्ट थ्री लेटर्स हो गए MES and F stands for the Messi fan. इधर अगर आप देखें the maxillary ethmoid sphenoid and the frontal sinuses, the first two sinuses maxillary and the ethmoid are present at birth, whereas the sphenoid and the frontal sinus are absent at birth. Maxillary sinus reaches adult size by the age of 15 years and it appears on X-ray by the age of 5 months. As it is the first to develop, so it is first to appear on the X-ray by the age of 5 months. So this is the fourth F of the maxillary sinus. एक F था, it is the first to develop and it reaches adult size by the age of 15 years. It has a volume of 15 milliliter and it appears on the X-ray by the age of 5 months. The next to develop is the ethmoid sinus. Ethmoid sinus reaches adult size by the age of 12 years and it appears on the X-ray by the age of 1 year. Sphenoid and frontal sinuses are absent at birth. ठीक है. कुछ बुक्स में अंग्रेज वगैरह में लिखा होता है कि sphenoid sinus are present at birth. लेकिन होता क्या है कि there is a small sphenoid cavity which starts pneumatization by the age of 2 years after birth. ठीक है. Pneumatization is the formation of the air cells in the sphenoid cavity and it appears on the X-ray by the age of 4 years. At birth हम ये तो कह सकते हैं कि we have a sphenoid cavity, लेकिन हम उसको sphenoid sinus नहीं कह सकते जब तक उसकी pneumatization start ना हो जाए. The last to start developing is the frontal sinus. It reaches the adult size by the age of 20 years and it appears on X-ray by the age of 6 years. So frontal is the F is for frontal and F is for furthest. So frontal is the last to start developing and it is the last to reach the adult size. Then we will quickly see the functions of the paranasal sinus. Number one function is the conditioning of the inspired air. कि जो हम एयर इंस्पायर करते हैं, जब उसको एक्सपायर करते हैं, एक्सेल करते हैं, तो वो पूरी की पूरी एयर बाहर नहीं निकलती, कुछ साइनसेस में ट्रैप हो जाती है. जब हम नेक्स्ट टाइम एयर इंस्पायर करते हैं तो जो पुरानी वाली एयर होती है उसमें से कुछ पार्ट उसको मिक्स हो जाते हैं, उसका टेम्परेचर भी थोड़ा इम्प्रूव हो जाता है और वो ह्यूमिडिफाई भी हो जाती है. नंबर टू इज इट एड्स टू द रेजोनेंस टू द वॉइस. इसीलिए जिनको साइनोसाइटिस की बीमारी हो, यहाँ पे जिनको साइनोनेजल पोलीपोसिस हो, उन पेशेंट्स में आपने नोट किया होगा दे हैव अ हाइपो रेजोनेंस वॉइस. ठीक है, उनकी आवाज की जो रेजोनेंस होती है वो कम हुई होती है. Third, it provides the thermal insulation to protect the contents of the orbit and the cranium from temperature variations. As air is a bad conductor of heat, तो इसकी वजह से एक थर्मल इंसुलेशन होती है जो आई और ब्रेन को प्रोटेक्ट करती है. Number 4, as it is an air containing cell, it lightens the skull bones. Fifth is it buffers against trauma to the brain. And number 6, it provides local immunological defense. कि इसके पास साइनसेस में कुछ एंटीबॉडीज होती हैं जो बॉडी की इम्यूनिटी को इम्प्रूव करती हैं. So the last slide of this lecture, we will see the histology of the paranasal sinuses. इसमें आपको सिर्फ एक बात याद रखनी है कि what is the type of epithelium of the paranasal sinus. Paranasal sinus is basically a respiratory type of epithelium which is ciliated columnar epithelium with goblet cells. तो अगर आप इसमें देखें इस डायग्राम में, you can see the cilia, उनके ऊपर एक म्यूकस लेयर है. ठीक है, they are columnar type of the epithelium. और इसके साथ यहाँ पे देखें goblet cells होते हैं which are responsible for secreting mucus. So what is the type of the epithelium of paranasal sinuses? It is respiratory type of epithelium which is ciliated columnar epithelium with goblet cells. So we have quickly covered the anatomy, the physiology, the embryology and the histology of the paranasal sinuses. ENT के पार्ट 1 में आपको इन्हीं चीज़ों पे फोकस करना है क्योंकि पार्ट 1 बेसिकली बेसिक साइंसेस का एग्जाम है, ये पैथोलॉजी का एग्जाम नहीं है. ठीक है, नाउ वी विल रिविजिट द CPSP MCQs. हमने पहले आपसे पूछे थे. वुड अप्रिशिएट कि आप चैट बॉक्स में या कमेंट में इनको टाइप करें. So which of the following sinuses are usually present at birth? A is sphenoid and frontal, B is maxillary and ethmoid, C is maxillary and sphenoid, and D is sphenoid and ethmoid. So whatever answer you think is correct, please comment or type in the chat box. Okay, so very good. I can see many correct answers. Correct answer is maxillary and ethmoid sinus are usually present at birth. So remember we had pneumonic, messy fan. M और E जो होते हैं ये present at birth होते हैं. और S और F जो है ये एब्सेंट एट बर्थ होते हैं. Maxillary and ethmoid sinuses are present at birth, whereas the sphenoid and the frontal sinuses are absent at birth. Next MCQ is maxillary sinus opens into A is superior meatus, B is middle meatus, C is inferior meatus, D is nasal septum. So, what option do you think is correct? Yes, Dr. Ali has correctly mentioned, and many others are also commenting. B is middle meatus. The maxillary sinus belongs to the anterior group of the paranasal sinuses, which all collectively open into the middle meatus. Third MCQ, which paranasal sinus is the first to develop in intrauterine life? A is maxillary sinus, B is frontal sinus, C is sphenoid sinus, and D is ethmoid sinus. So almost everyone has correct answer. A maxillary sinus is the first to develop in intrauterine life. The last for fourth MCQ is posterior ethmoid sinus drains into A is superior meatus, B is middle meatus, C inferior meatus, and D is sphenoethmoidal recess. It's very correct. So the posterior ethmoidal sinuses drain into the superior meatus. So this brings us to the end of our today's webinar. I would appreciate if you comment on the quality of the webinar in the chat box on the comment in the Facebook section.